Thank you for the invitation to be here from Evidence Synthesis Ireland. I wish I could visit Ireland, but it's great to be here. So I'm going to talk about equity, diversity, and inclusion in Campbell and Cochrane. Just want to start by declaring my interests. I hold funding from a number of government agencies and the Robert Wood Johnson Foundation. Also, my roles in Campbell as editor-in-chief and interim CEO, and in Cochrane, as Joanne already mentioned, as co-convener of the Campbell and Cochrane Equity Methods Group, and a member of the Cochrane Equity Diversity Inclusion Committee. These do influence my views. I have no other competing interests to declare. And I'd like to acknowledge my research team on the left and many collaborators over the years who've contributed to this work and made this work fun to do. I thought I will start by, I always like to talk about my different passions in life when I get to do webinars like this. And last month I talked about my passion for hunting for mushrooms, but today I felt like mountains was a good metaphor for what we're doing when we're thinking about equity, diversity, inclusion. Doesn't this picture make you want to run across this bridge? My daughter took this, she's backpacking around Patagonia. But I think mountains are appear to be inaccessible, but we can do things to make them more accessible. So you can appreciate them through photos like this one, through art, through poetry. And, you know, there are a number of mountains that are accessible by car, electric bike, chairlift, and whatsoever. So I hope you'll bear with me with thinking about mountains as we talk about equity, diversity, inclusion. And with that in mind, I wanted to ask a few polls just to understand who is here. I think I might need to, let's see if I can launch the polls. I'll relaunch the poll. Yes. Okay. Does that, I think that's showing you a poll. Which WHO region are you from? Yes. A lot of people responding, and about 20 or so have not responded. So I think I can end the poll and you'll see who's here. Still maybe 10 more people haven't responded. Finding the buttons. Okay, I'm going to end the poll. Share the results. So do you see those results? Yes. So it looks like 44% from region of the Americas, 48% from Europe, and 5% from Africa, 2% Southeast Asian region, and 2% Eastern Mediterranean. So I'm going to stop sharing. And I have one more poll for you on what perspective you bring. So would you consider yourself a patient, policymaker, academic, methodologist, practitioner? I think you might be able to answer more than once if you feel like you wear more than one hat. But if not, just pick one. It's just to get a sense of who's here. Most of you have answered, so I'm going to share the results. Okay. So we have a lot of academics and methodologists. That's great. I feel like I'm at home. We have 5% patients, so that's wonderful. 3% policymakers, 18% other, and 8% practitioners. So really great to have you all here. And then I think I have a last one. Oh yes, single question. Do you like mountains? The easy one. All right. Okay, so you've mostly answered, and I'm going to share. Most of you like mountains. That's good. There's a few pictures of mountains, not too many. Okay. All right. Thank you. Okay, it's really great to know where you're from. we didn't really know how to put in how long you've been a member of Cochrane or Campbell. So I'm sorry about that, but it's great to know we have a few diverse perspectives in different WTO regions. Okay, so I'm going to talk about mountains a little bit, and I want to sort of phase this. And I was trying to think of easy mountains to harder mountains. And I'm a Canadian, so I live in Quebec, so I always like to talk about Quebec mountains. And in Quebec, we have a very famous ski resort, Mont Tremblant. Anybody can go there. This is a picture of my kids several years ago, and the youngest one is 4. So anyone can go to Mont Tremblant and have a good time. And I was just talking with Joanne about what would be an equivalent easy mountain in Ireland. And I think maybe Binchleave, and I hope I've said that right, which is an easily accessible mountain. Next level mountain, Mont Albert, is a longer, bigger mountain, but you can still do it with, this is a 7-year-old, my 7-year-old daughter at the time, and hoping a similar one might be the Coran Toisdale. Not sure if I said that right. And then I couldn't think of a Quebec mountain that was the next level from Mont Albert. So Mount Assiniboine is in Alberta. This is a photo my father took many years ago, probably 45 years ago. It's called the Matterhorn of the Rockies, and it's a major trek to get there. The last mountain, I really couldn't think of a great example in Canada, so I picked Ruwenzori Mountains in Uganda as a trek. That's a typo. It's not 51,000 meters, it's 5,000 meters. But I think we're on a trek, we're on a journey with equity, diversity, inclusion, and Cochrane and Campbell, and really glad to have all of you here as part of this. Okay, so my talk is around 25 minutes or so. So I do think we'll have time for questions. And what I want to cover is sort of starting what is equity, diversity, inclusion. That's the smallest mountain, Mont Tremblant. Secondly, I want to cover how we define equity in evidence synthesis. So that's our next level, Mont Albert in Quebec. And the third level, what do we do to assess equity in evidence synthesis? So how do we do it? We're getting to Mount Assiniboine there. And fourthly, where next? So where is this journey taking us as in improving equity, diversity, inclusion in Cochrane and Campbell? So I'm going to start with a definition overall of equity, diversity, inclusion. I just love this definition from the University of Michigan diversity officer. And because we know that people in Cochrane love to dance. This is a photo from 2014. So equity is everybody has the opportunity to dance or experience the music. Diversity, everyone's invited, and inclusion, everyone gets to contribute to the playlist. So you can fill those out with more detail. So really equity is a commitment to challenge and respond to bias, discrimination, harassment, and provide equal opportunity. And I think when we think about Cochrane and Campbell, we don't want our systems to discriminate on the basis of things like race, national origin, age, sex, and many other things. Diversity, we want to welcome diverse people into Cochrane and Campbell, and no matter what their background. And inclusion, we want to make sure that people feel welcomed and that their perspectives are heard. With that, I think Cochrane and Campbell already, enshrine equity in our principles. These are shared principles across Cochrane and Campbell. Really, the 10th principle, ensuring wide participation, is about reducing barriers to participate. This is about preventing discrimination and reducing systemic barriers and encouraging diversity. So next step is, how do we think about equity when we think about evidence synthesis? So what does it mean in our systematic reviews and in our practice? In the Cochrane and Campbell Equity Methods Group, it's a joint group across Campbell and Cochrane. We've we use this definition by Margaret Whitehead from 1991. It's an old definition, but we feel it works well in systematic reviews. We're talking about differences in health outcomes that are potentially avoidable, and they're also considered unacceptable and unfair. So, you know, thinking about health, a difference that might be considered unavoidable, you know, something like breast cancer is more common in women than in men. This is not avoidable. But what might be unfair is that if men with breast cancer could not access treatment or were discriminated against in accessing treatment. So that judgment about what's unfair or unacceptable is a tricky thing for systematic reviews to do. And what we proposed to help with that judgment is thinking about all sort of characteristics and factors which might be associated with equity and inequity using an acronym called PROGRESS. And this was proposed by Tim Evans and Hilary Brown in 2003. And Jennifer Petkovic, at the time, Jennifer O'Neill, led a paper on this, operationalizing it for systematic reviews in 2014. So this stands for place of residence. So things like urban, rural, inner city, country of residence, race, ethnicity, culture, and language, O for occupation, people out of work or in different class jobs, G for gender and sex, R for religion, E for education, S for socioeconomic status, and S for social capital. And those factors are not the only factors. So that's why we call this a PROGRESS Plus acronym. And the plus stands for other factors which are associated with discrimination or exclusion, such as age, disability, sexual orientation, also features of relationships, so people who are excluded from school, and time-dependent relationships. And maybe the most important time-dependent relationship might be migration, as an example here. So when thinking about when to consider equity in reviews, and we worked about 10 years ago on developing an extension for the PRISMA checklist, the preferred reporting items of systematic reviews. And we proposed at that time that you would definitely want to consider equity if you had a question that was focused on people experiencing inequity. So for example, people who are homeless or vulnerably housed. And an example of that is a Campbell review on accommodation-based interventions for people who are homeless. And secondly, you would want to consider equity if you had a universal question which might have equity issues related to the intervention or to the problem. And we gave vaccination as an example because access to vaccination might vary according to PROGRESS Plus factors. But you could actually push this second category to almost all reviews. And I think that might be an interesting debate for the discussion. And recently we proposed this framework. Omar Duadar is one of the members of my team in that photo with the volleyball, who led a team of us with the COVID and Equity Task Force, thinking about a framework of how you think about equity from the beginning of the review. So how you build your team through how you ask your question, you search, collect data, analyze the data, interpret the data, and then report using PRISMA for equity. So it's really a process across your whole review. And we also proposed, yes, this year, we updated our review on equity in systematic reviews. And in this review, we propose a framework of 4 big categories of how you assess equity. And I'll get into more detail when I get to Mount Assiniboine. So this framework is description, so describe the populations in the studies. Analytics, so what are your ways of analyzing whether the intervention is as effective for people experiencing inequity as others, or whether your interventions are generating inequities. The third is applicability. So how generalizable are the results of your review to people who experience inequities? And the fourth is engaging people with lived experience of inequities in the review process. Okay, so now I want to get on to Mount Assiniboine. I wish I could go there. That's my father, my mom doing that with a group of trekkers. I want to talk about our chapter on equity in the Cochrane Handbook, and what we proposed as sort of the core to assessing equity in reviews. So in this chapter, we propose that where possible, a review should include explicit descriptions of the effective interventions, not just on the whole population, but also on people who are disadvantaged, and the ability of interventions to reduce socioeconomic inequalities in health. And this ties into one of our methodologic expectation standards. We have these standards in both Cochrane and Campbell, and we call them MESSIER for short. But in both our standards, we have a standard on considering in advance whether issues of equity are important in the review, plan the methods, and address them, especially related to specific groups. And we listed some examples here: low socioeconomic, low middle income country regions, women, children, and older people. But I think you could actually replace here with the Progress Plus acronym. So in the handbook, we proposed, and we only had 3,000 words, so we tried to keep it short. We proposed 4 methods for thinking about equity and for considering equity in a review. So first, think about it, the question formulation. Second, design your methods. Third, think about the implications for your summary findings table. It's a key part of the Cochrane review, not required in Campbell yet, but hopefully coming soon. And fourth, interpret the findings. So when you're thinking about equity, we propose, considering equity in the question formulation, possibly with a logic model, but I want to give you 2 examples that don't have a logic model. So thinking about equity could be related to the intervention. So in the first example here, it's a review that was led by Jennifer Petkovic on social media interventions. And we propose the intervention itself, has the potential to reach geographically diverse populations. But there may be barriers like the digital divide, language, literacy, acceptability, and those may come with a risk of generating inequity. So that's why we considered equity important in that review. The second example, I really wanted to give you a clinical example, is a review of hip fractures, arthroplasties for hip fractures. And in the background, the authors, and I've underlined it here, describe factors responsible for variations in the incidence of hip fractures, may include ethnicity, latitude, environment, and socioeconomic deprivation. So thinking about equity related to the health condition or the problem of interest doesn't necessarily need a logic model, but is still important in framing the question. And this is an example of a logic model. And in Campbell, we strongly encourage authors to use a logic model or a theory of change, partly because in Campbell, we're looking at, complex social interventions and really want to understand how those interventions are expected to work and where things like socioeconomic status and equity factors might change that pathway. So this is an example of a review on supplementary feeding programs. I'm sorry, it's in really tiny font at the top of the screen here. It was led by Elizabeth Christensen, one of the co-conveners of our Cochrane and Campbell Equity Methods group. And this slide is by Damien Francis, where you can see on the left that socioeconomic status is included in the logic model as potentially influencing substitution. And substitution is the practice where if children are given food at school, they may receive less food at home because the parents distribute the food in the household. So then your program of school feeding will appear less effective because there has been a household distribution of that food. So we included that in our logic model, and then we assessed that to the extent we could in the systematic review. Okay. Secondly, once you've decided if and how health equity is important, then you need to think about what are the methods you're going to use to identify evidence and appraise it or assess it. So I've got a lot of things on this slide, so it might take me a while, but so first, searching. So you might need to search beyond health. And I think my personal best example of this is I did a review a few years ago on deworming for children, and we found a study in a psychology journal through hand searching reference lists. Because deworming is expected to influence development. So we had not actually searched psychology databases, but in retrospect, maybe we should have. But we picked it up other ways. Second, relevant study designs. So depending on your question, you may want to include different study designs to assess equity questions. This is especially relevant if you're looking at community effectiveness rather than efficacy questions. You might want to go beyond randomized controlled trials, depending on your question. And we've just convened a working group in the Campbell, led by Hugh Waddington, on a typology of non-randomized study designs and a framework for how to assess risk of bias across all those different types of non-randomized designs. So it's being submitted to the journal SRSM. Please get in touch if you want to know more. And I think it's highly relevant for equity. Third thing, analysis strategies. So what are you going to do to analyze whether equity factors are important? This depends on your question. We recently published a Campbell review where on self-management strategies in schools, where the team did a moderator analysis looking at the role of ethnicity and found that those self-management strategies were particularly effective for African-American students. Fourthly, maybe this should have been third, is you need to assess who's in the studies and who's not in the studies. So what is the flow of participants? It depends on your question whether this is really salient. The best example of this, a colleague of mine, Jan Hatcher-Roberts, she co-directs the WHO Collaborating Center on Health Technology Assessment, Knowledge Translation, and Health Equity. She gave an example of a study. This was a primary study that was trying to recruit women who worked in rice paddies. And the study was recruiting during the time when the women were working in the rice paddies. So they actually completed their study, recruited people, but actually recruited the wrong people. So the people that are included in your studies matters. And in equity, often the people who come forward to be recruited to studies are more advantaged, wealthy, educated, have time available to participate. And that matters for the interpretation of your results. The fifth thing here, influence of process and context. Many of our Campbell reviews use a mixed methods approach to look at how process and context matter. And that might be important, depends on your question. Okay, third thing, summary findings table. So as I mentioned, this is really, the bottom line of Cochrane reviews, where people can see the results, the quality, and what it means in absolute numbers. And if you're thinking about equity, you might want to plan ahead for how your equity analyses will inform your summary findings tables. So you might have separate tables for disadvantaged populations or settings, or separate rows if you for differences in baseline risk. And this summary findings table is from an updated systematic review, which I believe started in early 2000s and was led by Carla Suarez-Spicer, the editor-in-chief of Cochrane. And this is, in this review, they made an explicit decision to stratify the results based on low, medium, or high mortality countries. And you can see here that the assumed risk and the corresponding risk in these low mortality countries on the top here shows a much greater absolute impact in the high mortality countries. And what I found out through presenting this last month from Carlos Suarez-Weiser is that this analysis was actually demanded by the decision makers who wanted to use this in countries. So this kind of analysis is needed to make our reviews more relevant. Lastly, you want to interpret findings in health equity. So my former CEO, Howard White, good friend, I don't think he climbs mountains, but he likes running. He always said you had to say things 7 different ways, 7 different times in order for people to get the message. So don't stop at the question formulation and analysis. You need to also interpret your equity findings. This is an example from that social media review that I mentioned, where we explicitly set out to look for equity data, and we actually found very little. Only 4 of our included studies, I think we've had over 70 included studies, had anything related to equity. So we concluded that future studies do need to disaggregate results so that we can better understand potential effects on inequities. Okay, and then I did want to just show a little bit of analysis about how Cochrane reviews are doing. This is really just Cochrane musculoskeletal reviews. It was led by summer medical student Nicole Janus in my team. And if you look at these yellow bubbles, when thinking about describing progress plus factors, these are the progress plus. There are a number described in the formulation of the question, the PICO framework. Not very many are planned in the analysis. Quite a few are described, but our description are focusing on place of residence, race, ethnicity, culture, language, gender or sex, and age. And there's very little analysis, no summary findings, and there's more assessment and applicability of results. This is actually a much better picture than when we did this analysis about 10 years prior. And similarly, when we look at sex and gender analysis, and this is analysis by Jennifer Pekovic in our team, she looked at all Cochrane reviews and Campbell reviews for analysis of sex and gender. And this blue bar is descriptive, so pretty good on description. The red bar is analytic, so there's much less analysis, and the green bar is applicability. So we are discussing applicability in some of our reviews, but we've got a little bit more on the journey to Mount Assiniboine to do. Okay, last, I just wanted to talk about where next. And so this is the Mountains of the Moon in Uganda. I actually just love the name, that's why I put the photo. It's a 7-day trek. So it's a journey, right, we're on. So there's 3 initiatives that are just underway. And I thought I'd just give you a sense of them, and please do get in touch if you're interested to be involved. So these 3 initiatives are looking at how to make it easier for Cochrane reviews to include equality, diversity, and inclusion. What tools do we need? Sean Trubeek and Declan Devane are leading that. Centering racial health equity in Cochrane reviews and all reviews. This is funded by Robert Wood Johnson Foundation. I'll tell you a bit more about it. And the third is we've just been approved as a Cochrane Equity thematic group. And I'll tell you a bit about our work plan. So the first there is funded by the Health Research Board of Ireland. So, so thank you if there are any members of Health Research Board of Ireland. This is actually part of Evidence Synthesis Ireland's next few years of work, and includes this as a work package. We're calling it PRO-EDI, and Sean Trubeek came up with the acronym, and I'm forgetting what it means. And the intent is to make it easier by developing tools for reviewers and building those into Cochrane workflows. And it builds on the Progress Plus framework and also the Include Ethnicity framework that was developed by Sean Terweek and colleagues. And as a starting point, we've started to identify our work plan, and we're starting to think about what is a minimum core set for describing who is included in studies, and then how do we make it easier for people to do that. And I'll give you one example table. I told you I'm from Campbell, so I always use Campbell examples if I can. So this is the same review on self-management by Brandy Maynard, one of our co-chairs and colleagues. And their table of included studies is actually a summary of all of their studies that reported race. They had 143 studies reported the race or ethnicity of participants. And then this is a breakdown of the overall proportion of students across those 143 studies that are Caucasian, African American, or Latinx. And they've done the same for gender reporting for sex, for reporting the number of male or female, and for grade level. So our intent with this initiative with Declan Devane and Sean Terweek is how can we make a summary table in our reviews that tells people who was included in the studies, and how do we make this easy to do for Cochrane authors. Secondly, centering racial health equity. This is just funded and is mainly led by Cochrane US and includes me as a member of Campbell. We just announced this funding 2 or 3 weeks ago, I think. Tiffany Duque is fearlessly managing a team of us. And what we hope to do is establish standards for reporting racial health equity in systematic reviews. And it's composed of listening exercise, which is being led by Meera Viswanathan at RTI International, which is going to assess what our users are saying about Cochrane reviews and other systematic reviews. And it also consists of 3 landscape reviews where we're assessing what are the methods and interventions for centering racial health equity. My team and I are leading on that one. What are the ways to incorporate equity in logic models? And Damien Francis is leading that one. And what are the theories for assessing racial health equity? And Patricia Hine is leading that one. Last thing I want to mention is that we got approved as a thematic group within Cochrane, which we're very excited about. Our leadership team is shown here, includes Elizabeth Christensen, a professor of psychology at University of Ottawa, Peter Tugwell, who you probably all know as a Canada Research Chair in Health Equity at University of Ottawa. Gabrielle Rada leads the Epistemologos Foundation in Chile. Tamara Lotfi is a PhD candidate at McMaster University and formerly led the Global Evidence Synthesis Initiative. Kevin Potty is a family physician at University of Western. Ashrita Saran is researcher in Campbell, South Asia. Lawrence Mwabo is also at McMaster, and myself. And the folk on the right here are the incredible Campbell and Cochrane Equity Fellows who are also part of this initiative. So our initial work plan includes setting priorities for reviews. So are we asking the right questions, and how do we prioritize updates of reviews to look at equity? And this is really building on work led by Eve Tomlinson and Peter Tugwell to prioritize which Cochrane reviews should be updated to assess equity. Secondly, we're looking at engagement with interested people and groups, which is called the Muse Initiative. So really engaging with people with lived experience, and how do you do that in systematic reviews well, developing guidance for that. Thirdly, looking at equity in observational studies, and I'm co-leading that with Lawrence Mwabo, Janet Dell, and Sarah Funnell. We're taking an approach to developing an extension of the Strobe reporting guidelines for observational studies. Fourth is looking at equity in COVID recommendations, and is really starting the work for looking at equity in all guideline development initiatives. So building on that, we aim to develop an extension for the Gin McMaster checklist in collaboration with Holger Schoenemann and the Grade Equity Working Group. And the sixth initiative here is being led by Mark Pettigrew and is focused on commercial determinants of health and how those influence health equity. So I think key messages, I hope I'm on time, I think so, is, assessing equity starts at the beginning. This is my mom tremblant. If you're going to start your kids, start easy. Start by framing equity and formulating your question. Albert, operationalize your methods. So the next step is, what are you going to do to assess equity in your reviews? Third step is, those methods to assess equity are needed throughout the review process. And lastly, we're on a journey. And I've really talked about equity, diversity, inclusion in how we do systematic reviews in Cochrane and Campbell. But both of our organizations, as most of you know, are launching equity, diversity, inclusion initiatives to invite people into Campbell and Cochrane. We're not the easiest organizations to understand or get involved with. So we do need to do some work to make it easier to contribute. And both of the organizations are on a path to do that. So I hope you'll cross this bridge. Even those of you who don't like mountains, maybe you can appreciate the pictures, and do please get in touch.